the Tema General Hospital has refuted claims that the baby died on Tuesday, March 24, when the lights at the facility went off after a general power outage. A video which has since gone viral on social media sought to suggest that a mother lost her newborn baby at the neonatal intensive care unit of the Tema General Hospital due to the power disruption. Now, in a press statement, the hospital acknowledged that the lights did indeed go off, but was restored within 2 hours. Here is a statement that came through from the hospital, and part of it reads that the incident happened on Tuesday, 26 March 2024, when the power from the national grid was interrupted and the facility was relying on the power plant. The dedicated generator set to the neonatal intensive care unit tripped off for a short period, and the hospital's electricians worked to restore power to the unit until the national grid was restored. It must be emphasized, according to that, the power was restored within 2 hours by the electricians at the facility. It is worth noting that no lives were lost as a result of this power outage. The Tema General Hospital assures the general public that the facility will continue to put the health and safety of its patients at the core of its business. And that's how the statement ended. So what really happened? Let me bring in Dr. Akosua Sapon, Dr. Akosua Ajewa Owusu Sapon for more on this matter. And she's the Regional Director of Health. Dr. Sapon, you're welcome to the post.
Thank you.
And your statement is quite clear and emphatic that there was no death as far as the power outage is concerned.
Yeah, thank you and good afternoon. Yes, as you rightly mentioned, on the 26th of March, there was a power outage, and then the facility, Tema General Hospital facility, generator started working at the NICU. The generator is connected to a lot of departments, including the NICU, that's Neonatal Intensive Care Unit. And as with time, the generator tripped. There was a fault, and the electricians at the hospital worked on the fault and restored the generator within a period of about 2 hours. But if you look at the video critically, you identify that though the lights were off, the monitors were all on, and you could even hear beeping sounds. You know, with our medical equipment, it is designed, our medical equipment are designed such that when we have power outages, there will be some residual power that can take the equipment up to 3 hours or so.
Right.
Because if we don't have that in place, and assuming you are operating a patient in theater and the lights go off, you know, there is power cuts, then it's really going to affect the survival of the patients. So this system has been inbuilt in most of our equipment. So though the lights were off, the generator had also stopped working for a while, but the monitors were working, the CPAP machines were working. So every child that was already on these equipment and needed oxygen or any other form of treatment via these equipments, continue receiving the treatment, you know, for the 2 hour period that we had the outage. So no child was deprived of any form of medical care as a result of the power outage because of the residual power in our various equipments. You know, so that is the situation.
You are saying that if there has been any death at all, it cannot be attributed to, it cannot be blamed on the power outage.
Exactly. You know, in hospitals, we all visit hospitals when we are not well, and we receive care. Sometimes, you know, the condition is worse, or the condition is such that you lose the patient. You know, so in hospitals, people go and receive care. People also go and pass on. If there is any death, hello.
Go on.
Hello.
Yes, please go on.
So if there is any death of a child or of anybody, we need to investigate to know the cause of the death. But for the power outage, the equipment that needed to support patients and needed power, continuously supported the patients because of the residual power in those equipment. So attributing a death to power cuts, is something that really didn't happen.
But yet you are yet to start investigation on this matter. So therefore, the conclusion may be premature as of now.
Yeah, we've started investigating, and we are requesting for postmortem of any person that died within that period that either relatives are attributing to the power cut. No, we are requesting for a postmortem to identify the cause of death. So the investigation is ongoing.
But doctor, I'm sure you've also seen video of a nursing mother who is claiming that her baby died in the process. Have you been in touch with this nursing mother to understand what happened?
Yes, I have seen the video, and my team at the hospital have been in touch, and they have briefed me. So what we are requesting is a thorough investigation, including postmortem, to actually ascertain the situation. Until then, we can't really ascertain the death to the power outage.
Neither can you also rule it out as of now.
Well, we are waiting to get the results of the investigation and the reports of the postmortem.
But what really is the issue with your power generator now that we cannot be certain when the power will go off and come back?
Oh, our power generators are okay. We all use vehicles. And from time to time, though you maintain your vehicle, you may end up having a problem with the vehicle at a certain time. So these are equipment, and they are being maintained, but occasionally we have some faults. And if that happens, the goal is how do we quickly restore the equipment, so that service delivery can continue. So that is the goal that we have, to have the continuous maintenance of our system and to quickly bring back any machine or equipment that, develop faults so that we can continue with our work.
Tema is in the news because some people decided to put out this viral video. I don't know what your briefing is regarding the entire region. There are some people who've called into our newsroom to say that they were at this polyclinic, the lights went off, and everywhere was dark because they didn't have any standby generator. What is the general picture in terms of the Greater Accra region and how you are responding to this uncertainty with power generation?
Thank you very much. The general picture within Greater Accra region, most of our hospitals and polyclinics, the big facilities, have generator sets as backup, But looking at the kind of services that they provide, sometimes some need a bigger generator, like capacity. So they all have backups, but of course, we will still request for more generators from individuals, reputable organizations, the government, and anybody that can support us. But currently, they all have a generator sets.
And so, I mean, if I get you right, there isn't any kind of a formal communication telling you that this is the situation we are facing with power delivery, and for that reason, you should have some kind of a backup or be on the lookout in case there's a power outage and what you ought to do.
Well, the formal communications have been coming on and off, not during this period. And we also send these communications to headquarters, and they support us as and when they get these equipment. It's a continuous process. So from time to time, we get these requests, and then we also work on the request. But I know that in all our district hospitals, all of them have gen sets, generators as backup. And our polyclinics also have. Even the smaller polyclinics, we are working hard for them to also get generator sets to be able to support service delivery.
Thank you so much for your time, Dr. Sapon. She is the Greater Accra Regional Director of the Ghana Health Service. Now,